Ever feel like the shorter days and colder weather drain your energy and mood? You're not alone. You're not imagining it. It could actually be seasonal affective disorder, or SAD. It's more than just the winter blues. SAD is a real type of depression that hits when the seasons change. But don't worry, in this video we'll break down what SAD is, why it happens, and most importantly, how to beat it. From light therapy to lifestyle hacks, we've got you covered. Also, I will be discussing how SAD can impact children and adolescents specifically. While less commonly diagnosed in younger populations, it's important consideration for parents, teachers, and caregivers to recognize and address. Let's bring some sunshine back into your life, no matter the season. So what actually is seasonal affective disorder? SAD is a type of depression that follows a seasonal pattern, typically starting in late fall or early winter and improving in the spring or summer. Some people experience the opposite, feeling down during the warmer months, but winter SAD is the most common type of seasonal affective disorder. For children and adolescents, symptoms can often overlap with typical developmental changes, making it actually harder to diagnose. And this can sometimes include symptoms such as low energy, low concentration, oversleeping, weight gain, feeling hopeless or irritable. If this sounds similar, it might be more than just the winter blues. So why does SAD happen? Scientists believe that SAD is linked to reduced sunlight exposure, which can mess with your internal clock, lower serotonin levels, that's the happy brain chemical, and increase melatonin, making you feel sleepy and sluggish. It's most common in places farther away from the equator, where daylight hours dramatically shorten during the winter. Like adults, children and adolescents experience changes in their internal clocks, their circadian rhythms, and brain chemistry due to reduced sunlight exposure, which can lower these serotonin levels and increase melatonin production as well. This is resulting in mood and energy shifts during these specific seasons. So what are some symptoms of SAD in children and adolescents specifically, or anyone with SAD? These symptoms can look like various things such as mood changes, persistent sadness, irritability or withdrawal from family and friends. And this would be different than how they had been experiencing their mood before. Energy levels, feeling very fatigued or difficulty getting out of bed, even after adequate sleep would be another sign or symptom. School performance, a decline in grades, trouble concentrating, or loss of motivation is another symptom. And sleep pattern, oversleeping or increased difficulty waking up in the morning is another sign. And appetite changes, such as cravings for carbohydrates or more sugary food, potentially leading to weight gain. And behavioral changes. This is the big thing with younger populations. So increased emotional outbursts, crying spells, or lack of interest in activities that they might have once enjoyed. With children and adolescents, they might not have the vocabulary to describe how they feel, so their symptoms might appear to be more behavioral in such like irritability, tantrums, or reluctance to engage in play. And for the older adolescent population, they might attribute their symptoms to typical teenage stress or dismiss them as just being tired, which can actually delay recognition of the problem. So what are some risk factors for the children and adolescent populations for SAD specifically? This can happen if they live in regions with long winters and limited sunlight, or have a family history of depression or other mood disorders. Also, if they already have an experience with mental health challenges with anxiety or depression, this might be another risk factor for someone being able to have symptoms of SAD during these seasons specifically. So how do we actually treat seasonal affective disorder? Number one is light therapy. So one of the most effective treatments is light therapy, and that is a special light box which mimics natural sunlight, boosting serotonin levels. Just 20 to 30 minutes a day in the morning can make a big difference, ideally before work and school. A pro tip is to make sure that the light box is at least 10,000 lux and UV-free for safety. You can find these light boxes in many reputable places and even find them on things like Amazon. Another type of treatment is actually talk therapy. Cognitive behavioral therapy, or CBT, is another effective option, and it helps reframe negative thoughts and develop strategies to manage seasonal challenges. Another type of treatment is medications. In some cases, doctors or psychiatrists such as myself might prescribe antidepressants, especially if symptoms are severe, but you always need to consult with a professional to see if this is right for you. And finally, lifestyle changes. Don't underestimate lifestyle changes. Exercise, a balanced diet, and spending time outdoors, even on cloudy days, can boost your mood. Maintaining a balanced diet and avoiding excessive carbohydrates or sugar cravings and sticking to a consistent sleep schedule will all be supportive for treating seasonal affective disorder. So how can you actually support children and teens who are struggling with seasonal affective disorder? One would be to have open communication and talk with your child about their feelings. Let them know it's okay to feel this way and that help is available. Number 2, monitor their behavior. Keep an eye on mood changes, academic performance, and social interactions. Number 3, create a routine. A structured daily habits can provide stability during seasonal transitions. And number 4 is maximizing daylight. Encourage outdoor activities, especially during the daylight hours. So what are some general quick tips for managing seasonal affective disorder? Number 1, really trying to stick to a consistent sleep schedule. 2, getting outside daily, even if it's just for a walk during sunlight hours. Number 3, stay connected with friends and family. And number 4, plan something fun to look forward to, like a winter hobby or trip. So when should you seek professional help? If the symptoms have persisted for more than 2 weeks or have significantly impacted daily life, or thoughts of self-harm or safety is a concern, consult with a mental health professional or psychiatrist immediately. Early intervention is key when it comes to managing seasonal affective disorder effectively. Seasonal affective disorder can be challenging for everyone, children, adolescents, and all ages, but with the right awareness and support, it's entirely manageable. By recognizing the signs and taking action, you can help your child or loved one navigate the seasonal shifts with resilience and confidence. Thank you for watching. If you found this helpful, give it a thumbs up, subscribe for more mental health tips, and share your own experiences in the comments below. And make sure to check out additional videos on mental health and wellness in our channel. Remember, you're not alone in this. See you next time.